Welcome to the Newborn Hearing Screening IDS Database Webinar Training. My name is Erica McKiever, and I'm the Early Childhood Screening Supervisor of the Newborn Hearing Screening and Newborn Metabolic and Genetic Follow-up Programs. This training is to be used by those professionals who are responsible for submitting newborn hearing screening data to the state per the recommended newborn hearing screening guidelines. First and foremost, I want to thank you for viewing this webinar and attending the training. By doing this, you have taken a big step in improving our follow-up program, which ultimately helps our Colorado babies lead a healthy and productive life by potentially detecting a hearing loss at the earliest of stages in the newborn period. So before we go directly into our training module of the database, I want to talk a little bit about the system and its history and the importance of all screening, evaluation, and intervention sources utilizing this system. Please know that our program is often referred to as the EHDI program, EHDI, which is an acronym for Early Hearing Detection and Intervention Program. Our homegrown database is called the Integrated Data System, otherwise known as IDS. This web-based system is used for other CDPHE programs as well. We're able to use our data in this system to provide reports to all of you in order to evaluate your progress or to determine new ways to better implement services throughout the state. This system also allows us to provide data on an annual basis to report to the CDC and the Maternal Child Health federal agencies. It's important that all birthing centers run reports and enter data on a consistent basis, which is recommended to occur monthly in order to provide the optimal follow-up program. IDS is strictly a follow-up system. This means that the only babies that will show up in our database, in IDS, or in your follow-up reports are babies that are showing as either missed, not screened, or showing as refer or fail. The missed and not screened category is 1. Without these documentation of follow-up services, sometimes babies can fall through the cracks. If it's submitted on a baby's birth certificate that the baby has passed both ears, or what we'll call a bilateral pass, then the baby's record will not load into IDS, but remains dormant, for lack of a better word, in another system, unless we need to retrieve it. So just to give a little bit of history on our data system, it goes as far back as 1991 when our Colorado EHDI program was just a pilot project, and we collected only aggregate data on the number of births versus the number of babies that were screened and did not pass. In 1998, we were able to add these results, the initial screening results, to the electronic birth certificate, or we'll call that the EBC. In the year 2000, CDPHE was awarded a Level 2 CDC grant to develop a virtual child health profile that we're able to use. This is what our IDS system is today. And we still get this grant money in order to maintain and improve the program. In 2012, our early intervention providers were able to enter directly into the EHDI IDS, as we'll call it. And then in 2010 and 2011, we started training hospitals throughout the state to enter any missed or follow-up results directly into IDS, and that's part of this training today. In 2013, newborn screening results are going to be added into the immunization registry. We're actually looking at getting that accomplished in the fall of this year. And this year, starting this summer, we'll be training audiologists to enter their evaluation data directly into EHDI IDS. And with the completion of all of these areas, we'll have a very comprehensive data system. So just to give everyone a little bit of information on what our data flow looks like, by looking at this slide, you can see how data is transmitted at each stage to understand how your participation in data entry fits within the overall system. The information begins with the electronic birth certificate system, or the EBC record. This is how a baby's record is actually generated in our IDS system, and it's how we're able to quickly get a glimpse at exactly how many of our Colorado babies are being screened. This information goes from the EBC to what we call NEST, and that's the circle in the center. This stands for Newborn Evaluation Screening and Tracking. This is basically a centralized data warehouse that does a cleanup of all of the data that comes from our electronic birth certificate record so that all pieces of a baby's record are combined accurately into one. If the baby's record shows that there's a missed screen or that the baby referred on a screen, it is then uploaded into the IDS system. Now, this becomes a two-way system where we get the information from NEST, but once we add updates into IDS, that information also goes back and updates NEST. Then we're able to run multiple types of reports within both databases. So this is just a quick look at what we used to do to try to get our data results. We've basically gone from paper to the web starting in 2010 when trainings with individual hospitals were started. Our goal is that all birthing hospitals, and soon any other professionals who are screening babies or providing audiologic evaluations, will be entering data accurately and efficiently into our web-based data system. Our interventionists already have access to this database. As you can see by this slide, there were once multiple steps involved with getting a report to a hospital, who then was responsible for gathering results and manually handwriting them on a report. Then that report had to make its way back to the health department, either by mail or fax, for our staff to enter the data into the database. This could sometimes take up to a month to complete the cycle, sometimes even more. So this is what it looks like now with the web. Each hospital now has the freedom to run a report independently and better manage their time to get results entered. So you can see the first step starts with us basically communicating with you monthly and letting you know what the date ranges are going to be as a little reminder to run your reports. And then here the hospital coordinator runs the report independently directly from our database, which then gives you the information you need to enter directly into the database any results that you may have. So now I'm going to go ahead and go to our training module. So just know that I'm going to kind of toggle between two different data systems. The one you're seeing now is our training module. We can identify that because at the top it says Health Informatics Data Systems in red. If I were to go into our real data system, at the top you'll see that the Health Informatics Data System letters are in blue. So this will help me to know which one that we're going to be working off of. If you're not currently set up as a user for this database, you can just contact me and I'll send you an information sheet on how to request yourself as a new user. I can show you here briefly where you can go to do this. We'll not spend a lot of time on that, however. If when you're ready to do that, we can do that together. What you would do is you would come into this area below the login area where it says request a new user account. From there, there's just a few steps, very similar to any other kind of website that you would be using to set up an account. And I can send you the documents to guide you through that. Once you go through that process, it'll ask you to read and sign a user agreement. As with most programs, this will ask you to agree that you'll use the system responsibly and only for purposes related to your work. So again, to request a user status, just contact me first. Once you're a user and you have set up your security questions, if you're unable to log in after 4 tries, the 5th incorrect login will actually lock you out. In this case, you can contact me. I can unlock your account and reset your password. We do have a couple backup people who are able to do that in my absence. If you have unsuccessfully attempted 3 or 4 times to log in, at that point I recommend that you go to this area again below the login section that says can't access your account. This will default to the typical question and answer security questions similar to what you're used to when you're using something like online banking or another website that requires a password. When you set yourself up as a user, you will go through the security questions setup, and that will set up the answers that you'll use during this can't access your account process. And then as usual, if that doesn't work, still contact me. So I'm going to go ahead and get into the data system now. Again, I'm going to be using this training module. Because it's a training module, sometimes this one can take a little bit longer than what it might take for the regular one to load. So while we wait for the testing module to load, just keep in mind that this database works best Internet Explorer, not so great in Google Chrome. So if you find yourself opening it in Google Chrome and you're having trouble, it's best to go ahead and go back to the Internet Explorer browser and do it that way. If your computer system has Windows 10, you'll need to contact me to get instruction on how to set up your web browser to adequately use the system. Right now, our database has not been upgraded to function properly within a Windows 10 environment, and there is actually a simple step you can do within your browser that will help this website function properly throughout your system. Okay. So now I see we're actually into our system. One thing about once you're in, I have noticed while I've done some face-to-face trainings in individual hospitals that the data system actually runs a little bit slower in hospitals, and I've noticed it works for me. That's likely due to security system setup within the hospital. Since this is web-based, you are able to access the database from any computer that has an internet connection. So typically for those of you who work in hospitals, sometimes you don't have a dedicated location in order to sit down and enter data. So this kind of solves that problem by giving you the opportunity, if you have a laptop, as long as you have internet connection, you should be able to log into this database. Now that we're in the database, when you log in, you'll see that the home screen looks like this. It's definitely good practice to check your contact information on a regular basis. As you'll see here, your username, first name, last name, and your email. If anything changes, you can contact me and I can make the appropriate changes into the system. We rarely do email notifications directly through our data system, but on occasion we actually have done that, and so we do like to see that these email addresses are updated. So now I'm going to go through each tab and just give a brief explanation of what each one will do for you, and then I'll go into each one in detail. So the Home tab is what we're looking at right now. Just so you know, in this tab you have some functionality around changing your password in this tab here. You have functionality around changing your security questions. And really in this, for our purposes, those are the only two tabs you should probably have any need to go into. Now the Search tab here, this is kind of what I call the meat and potatoes of searching for a record. This is if you need much more information than to just go in and enter data. So you can see here by looking at this box, you have a lot of options to try to locate a baby. When you enter searches with a baby's name, I always say less is more. Anytime you enter a baby's name, and if you're a letter off, or same with the birth date, if it's a birth date, if the date is off at all, our system will not identify it. If you put, say, for example, the first three letters of a last name and the first three letters of a first name, you probably would actually be more successful in finding that baby's name. You also have the option of looking up information by the mother's name. You can select mother, you can select the mother's last name and a first name, and I know this is really helpful for hospital environments, as sometimes you actually in your own records don't have a baby's official name that would be listed on the birth certificate. Now keep in mind, when a baby's name pops up in here, it's going to be what's listed on the birth certificate. Then we have a Reports tab. We're going to go into this shortly. This is where we're going to be able to run our follow-up reports, which will give us our information on what babies need follow-up attention. The Providers tab, we're actually not going to talk about that today. You won't have any need to go into that tab. That tends to be something that I use more often. And then the Data Entry tab. This Data Entry tab used to be called Quick Entry, which is actually, in my opinion, a better name for that because it was designed, as opposed to our Search tab, the Data Entry tab was designed to kind of do the quick and dirty data entry when you just have like 1 hour to enter as much as you can. It gives you the option of just looking up one baby at a time, going straight directly to the hearing screening information and entering data quickly. So what we're going to do is I'm going to go through how to run a report, which is going to be your first step every month when you're ready to update records. So you'll click on Reports. And remember, this particular training module is a little bit slower. I'm going to skip to our real database after I show you this section, just so that we can run a little bit quicker. But this will show you what your report section will look like. These are the options that you will have: hospital follow-up and hospital outstanding reports. You actually will also, in the real data system, you'll have an option for hospital outstanding transfers. We're not going to talk about that during this training. That's kind of a sort of a little bonus for some people to use. I'll keep that out of this particular training, and but it will show up when you are logged in as yourself. And the report that we're really going to focus on is going to be this hospital follow-up report right now. And I'll explain what the other report does for you next. So I'm just going to skip over to show you how to run a report as I log into the real data system. You'll notice that when I log into mine, it's going to look a little bit different, and that's just because I have access to our entire system. So some of this you are not going to see when you log in as yourself. And don't be alarmed, when I go into my report section, I actually have a ton of reports that I'm able to select from. So remember, back on your training module, you will only have a few options to select from for reports. You're going to notice that I have a lot, but I'm going to go to the same report that you would go to. So what we want to do when we run a report every month is each month around the 15th of the month, you will sit down to run your report, which is basically going to be your working document to let you know which babies need attention. You do not have to run the report on the 15th, but rather just look at your calendar and determine within that week or so what day would be a convenient day for you to run the report. You then have about 2 weeks to gather your data and enter this data into IDS, which then we'll cover how to do that in just a minute. The reason it is determined that you have 2 weeks from around the 15th of each month to enter data is because we run parent letters on or around the 1st of each month. These are letters that are generated for babies and their families the babies are approximately 2 months of age, that are showing in our data system as either having been missed or having referred without follow-up. We try to be up to date on our data entry in order to prevent a family from receiving a letter when their baby indeed has been screened and actually passed. Parents are often alarmed when they receive this letter. Sometimes their baby they might think that their baby actually failed the screening when really they actually passed. We want to prevent this from happening, and the best way to do this is to make sure that we stay up to date each month by entering all results before the 1st when the letters are generated. On occasion, we aren't able to actually run those letters on the 1st, but that is always our goal, and it's always safe to assume that your data should be entered by that date. If ever you find that you're kind of in a bind and you just can't get your data entered by that date, please just contact me, and we absolutely can figure out how to maybe run it a day late or a couple days later, so you would just let me know. So for purposes of running this report, the hospital follow-up report, what will happen once a parent letter is generated for a baby, this baby will fall off of this report. So this really does stick to being a follow-up report. Once the baby's 2 months of age and the letter is generated, you will no longer see that baby on this particular report. So we always want to use a date range of at least 1 year, and that's just in order to assure that each month we can capture all babies that might need follow-up. Every month I will provide a monthly email to you, and I'll provide the date range on that's recommended. In this case, I'll show you in our process in our real database that I will use an old date. I'm going to use an old date in order to prevent any names popping up on a report in order to show you the entire process of running the report. And so normally we would put our current dates, but for this training purposes, I'm actually going to put an old year, but a similar date to what we would normally use. So since it's May, we're in the middle of May now, we're looking at the possibility of running our reports around May 15th. We want to use the month previous as our end date. Obviously, in real time, we would use 2013 instead of 2009. And then our start date is going to reflect, 30 days in April. Our start date is going to reflect 1 year prior. And then for me, I have option to run reports for all of these hospitals. However, when you are logged in as yourself, you will only have access to the hospital where you work. If you are responsible for more than one hospital, we will make sure that we give you access to every hospital that you're working with. And then you would have access to all of those hospitals. So I'm going to go ahead and click Submit. And what this does is it gives us basically a snapshot of your report. So when you are ready to run your report, what you may see if you have baby's records on your report is below, in this area here, it would probably show some of those records. And it'll have the proper date range at the top. This is showing up like this because there are no records in this particular time or date range for this hospital. And I did that on purpose again because I didn't want any babies' real names popping up during this training. So with that, we need to complete the process, which I'll show you, and then I'll move on to a report that I have created prior to this training in order to reflect our mock cases, again, because I can't show you a real report with real baby names. So I've already saved another report in a PDF document, but for purposes of the training, I want to walk you through the process to get your report. So again, this is a snapshot. We want to create the entire report by going to select a format and click on that drop-down box. You're going to select Acrobat PDF file. Now the step that people often forget to do after this is you have to go to this export button and you click on export. And this is what begins to create the PDF file. So typically on your system, you will also have a dialog box that's going to ask you to go ahead and open up your PDF file. And so you would just click open. So what we'll show is a report that will pop up in a PDF format. You'll see what I created in this particular search didn't give any records, and that I did on purpose again. And we'll go back to the data system. And so what I'm going to do now is I'm going to go ahead and get our mock cases. So this is a report that I've created prior to the training. So this is what the report's going to look like once you run it. It's actually, the system I'm noticing is taking a little while to load some of the information. Normally you would see here, it would have your date range. And you'll see your name should appear in this section here, and your hospital name would appear in this left section over here. And so what you'll see on this report, this would be a comprehensive list of any babies that are requiring some kind of follow-up that you will be able to use as a working document. So you'll see here, so this baby, Bob Test B, you can see the mother's name, you can see the mother's last name, in parentheses would be the mother's maiden name and the mother's first name. And again, these are mock cases, these are not real names. You would see the baby's birth date here, and it would have an IDS number. And this sometimes comes in handy for us when you want to look up a baby by their IDS number rather than their name. And so what we'll do is we'll use this as our way to go through different cases or case scenarios in the data system. So one thing to keep in mind with this report, this is not where we enter data directly. We'll actually have to go back out into our data system. This is just a working document that you can actually save or print. you will start to find what is the best mechanism for you to be efficient during your time of running and looking at reports. What some people do is they print this report, and then whatever system you have established at your hospital, so for example, some hospitals have a written log that sits in the nursery area that those who are doing the screening will put information in. If that's the case and you want to print this and run around and gather data by writing it in here, that's fine. Some people actually have to look up data within the electronic birth record or within the electronic medical record, and you could add it on here. So depending on your system, and I'm happy to work with people on an individual basis to talk about what might be an efficient use of time to gather that information and get it entered. But again, this is just a working document. So I'm going to minimize this. We'll probably not use this again because I'll know what my test cases are. And give me a second while I pull up the database again. So now what you're going to have to do is you're going to want to leave this section to go back to our data system. And what you're going to do with that is you're going to hover over in the top right-hand corner, hover over your name, and then click on IDS Data System. So this brings us back to our home page, actually. And now we're ready to enter data. So I'm going to leave the real data system with my login. I'm going to leave this, and I'm going to go back to our training module and do the same thing. I'm going to hover over my name and go to IDS Data System. And then now I'm ready to enter my data for each individual baby, and I'm going to do that by clicking on Data Entry. So here's what it's going to look like. This, again, as I mentioned, is our quick and dirty option of just getting data done. And sometimes some of you may have certain admin time where you only have a few hours a week or so to get this type of work done, given that many of you wear different hats within your organization. So what I'm going to do, again, there's multiple ways that you can find a baby. You can get your report and find their IDS number, as I showed you earlier. And you can add it into this section here and click on search, and that'll automatically find your baby. I do always recommend, if you do it that way, you want to make sure that you double check the name that shows up and make sure it's the correct baby. You can also use date of birth as an identifier, and again, you can use a few letters of the baby's name. But I know that my baby's last name is Tess BBB. And since I know that this is the only baby that's going to show up for me, I'm going to go ahead and select Do Search. Now this baby pops up. If a baby, for example, with the same name is born in your hospital, then you probably would see multiple entries here. And you'll want to verify through date of birth that it's the baby you're looking for. So I'm going to click Select. And so now I'm in the record for this baby. So what I'm going to do is just use this record to show you a few things that we'll need to cover, a few different scenarios, actually. So I have 3 cases or 3 records to show you. And I'm going to use this one to actually go through a few different scenarios. But first I want to give you a little description of what this screen is all about. This is what we call our hearing screen within our database. What you'll see here is at the top, you'll see the baby's full name and their date of birth, and then this is actually going to be what their IDS number is. Here is their date of birth, and again, these are mock cases, so we made up the date of birth. This section where it says screened, yes, no, or unknown, we actually don't pull any specific data from this field. As I mentioned before, this entire system has been used for other programs, so sometimes bits and pieces from other programs are kind of still lurking around, and that's what this is. So I would not worry about this at all. It's going to default coming in as saying no, and that's okay. Don't worry about clicking yes unless it really bothers you and you want to mark yes. Here where it says reason not, this is a good example of why a baby has not been screened. Typically it's because the baby is in the NICU. And so, as you may know, we typically will not screen a baby until they're healthy enough, which is usually close to discharge. And so sometimes it's going to come through our system before that screening has been done. Another reason that happens for not being screened with the NICU babies is sometimes they've already been transferred from one hospital to another. And usually we'll see a little note from our electronic birth certificate down here in this note section that'll say transferred from whatever hospital to whatever hospital. And the new location will be marked in this section here. Here in this field is where we're going to see our results. And that's where we have the ability to go in and change our results accordingly. And then I'll talk a little bit about notes here in a minute. Down below where it says record information, this is what I call our timestamp for the creation of our record. What you'll notice is here it says created by, and it says nest. So if you remember back when I showed you our data flow, we had that circle in the center and it was called nest. And that's basically our data warehouse where all of the information gets organized. And so this is telling me that this is raw information that has come directly from our nest database. And this tells me when that was created. So that tells me when, at what time, and on what day that this record was created in the IDS data system. This says nest right now as an updated by, but once we go through and update information and then click update over in the bottom corner here, then that's actually going to change to your username as the user who updated this record. And then it'll let us know on what day that happened. So what I'm going to do is first I'm going to let you know how to complete a transfer within this record. So let's say, for example, there was a baby who was at a hospital that had a NICU, but the baby became ill enough that they needed to be transferred to a higher level NICU, such as maybe at Children's Hospital or University Hospital. So in this case, what we want to do, so now you're the hospital coordinator, you've run your report, and you see that this baby is showing up on your report. And you know that this baby is no longer in your hospital, but has been transferred to, let's say, Children's Hospital. So what we'll do, this baby has not been screened and is no longer at my hospital, but I want to transfer the baby. So I'm going to go to this reason not field. I'm going to click on this drop-down box, and I'm going to select transferred. As you'll see, there are a lot of options here that will help you determine what is happening with this baby. We're going to select transfer, and then the important part here is to go ahead and select the new hospital where the baby is gone. And in this case, I'm going to select the Children's Hospital. Right now in our data system, we haven't changed the name of the Children's Hospital. Right? It should be Children's Hospital Colorado, I think, but right now it's showing us the Children's Hospital. So once we select that, if you want to put a note, you can. It's probably not necessary in this case. You have determined that it's been transferred, and you've determined that the baby has gone to Children's Hospital. If you do not update this location to the Children's Hospital, what will happen is the Children's Hospital site will then not see this baby on their report, and they will not have access to this record. That impedes our follow-up system because then they are not alerted to the fact that this baby is going to need a screening. So it is very important that once the transfer happens that we complete the transfer in the data system in this manner. So once we do this, we click update. Anytime you click update, you really want to look for this little message that says success, record has been updated, and then you click OK. This is how I know that the record's been updated. If you're in the middle of updating a record and you get interrupted or distracted and you have to step away from your computer, we do have a timeout system for this program. It's probably around 20 minutes. If you did not update the record, you will lose the information because the data system will ask you to log in again. So now we've clicked Update. Now you see that the record has been updated by me because it has my username in here, and it has changed the time to the current time. So that's how you do a transfer. Now what I want to show you is another important update. And this is in the event that you know of a baby that has passed away. This is not typically common for some of the smaller hospitals. Usually the babies who are ill have already been transferred out to the higher level NICU hospitals. So this does happen more often for those hospitals that experience babies passing away a little bit later after birth, maybe even sometimes up to 2 months later. All you have to do, and the reason why this helps us, is if you know of a baby that is deceased, you can click on this selection that says deceased. And I'm going to actually click this back to its original state. So you would click on deceased. If you want to put a note, for example, maybe you know what day the baby deceased, maybe you want to put a note on how you heard that the baby passed away, perhaps the parents told you, perhaps you saw it through a medical record, you could put a note in there like that, and then you would click Update. What this does, and the reason why we find this to be very important, is it will take this baby off, it'll untrack it as we call it. Once it's untracked, then no letter will go out to the parents at that 2-month mark. This is really important for us. It's a very hard phone call to take when a parent has received a letter from us saying, congratulations on the birth of your baby. Our records show that your baby did not get screened. That's how the letter opens. So what we really want to do is avoid any possibility of a letter going to a parent like that. Sometimes due to circumstances and the timing of the death, we can't always completely prevent that. But our system is set up in a manner to where it automatically gets deactivated once the death certificate has completely gone through our electronic or the vital records system, and then that gets passed through into our system. Unfortunately, oftentimes with the death of an infant, the cause of death may need to be examined, and usually a death certificate is not complete until cause of death is determined. This can delay the process of getting a death certificate submitted, which then ultimately delays the process of our IDS data system being notified and deactivating the record. So this is a way for us systemically to be able to prevent that communication from occurring. Okay, so I'm going to actually take this record back again to its original state, because now I want to use the scenario that this was a baby that for whatever reason wasn't screened, or let's say the baby was screened, but for some reason the information did not get entered onto the birth certificate. And so now, as the hospital coordinator, you see that this baby is showing up on your report, and you've gone through your records and you find that this baby did have the screening and the baby passed in both ears. One thing to take note of is when the baby comes into your system, this date here is actually a default date that pre-populates as it enters the system. This can be confusing. You want to take note that this does not mean that this is a date that the baby was screened. What this really in reality is typically it's the date that the birth certificate went through. So you'll want to take note of that, and you'll want to determine and let the system know really truly what day did this baby get screened. So we're going to say that you know this baby got screened on the day after the baby was born and the baby passed. So you update the date. You also have the option of a date selection. And then you're going to do a drop-down box on the left ear. Please take note that the left ear is listed on the left side and the right ear is listed on the right side. In some cases and in some hospitals, you may see that the results are listed opposite. So every time you enter results, you want to make sure that you notice that you are accurately putting in for the left ear the correct result, and same for the right. In this case, the baby passed both, so we're going to add that. And at this point, we probably don't need to see any notes because the baby passed, and that's all we need to add. Once you hit update for a baby that has a bilateral pass, if you were to run your report now, you will notice that this baby's record falls off of your report. So that's another way that the baby will fall off your report. When the baby is shown as deceased, it will fall off your report, also with a bilateral pass. Other reasons that the baby will fall off the report is if you have a transferred out of state. Parental discretion will also have it fall off your report. Parental discretion means that the parents just refused to get the screening. Oftentimes that actually makes it on the birth certificate, so hospital coordinators often don't have to mark that unless they're refusing the follow-up screen. That's a good one to add. And a lot of these other ones, though, usually they'll stay on your report for those. So what I want to do in this for a last scenario is, in the event that the baby maybe did not pass, we would go down and we would select referred or failed, and we would click update. So keeping in mind that once you do that, then this baby's record will remain on your report because it will continue to need your attention and follow-up. In these cases, every hospital is different with how much follow-up you provide. We obviously appreciate every hospital and their efforts to contact families and get them to come back after a baby has referred on their hearing screening. So if you have any questions about what you should be doing for follow-up, please contact me. We can discuss what's appropriate for your hospital depending on size and staffing, and we can discuss what other hospitals of your size are doing currently. Okay, so what we're going to do is we're actually going to clear out of this record, and I'm going to look up, I'm ready to look up my next baby, but I want to show you how it's easy to pull up multiple names at one time if they're similar names. So I happen to know that all of our mock babies' last names begin with T-E-S-T, and so when I put in test, the system will find for me any babies that have those similar letters beginning in their name. So now I'm actually ready to go into my next baby record. So in this case, this is a record that has come in to IDS. Again, this is a raw record from our NEST system, which is just information from the vital records or birth certificate. So it was recorded on the birth certificate for this record that the baby did not pass either ear. And this date here would be accurate because our vital records data entry people have the opportunity to add in a date that was listed for the screening. So what I want to show you in this record is I want to show you how to enter a follow-up screen. So to define initial screen versus follow-up screen, keep in mind that initial screen typically is the screen that happens while the baby is admitted in the hospital after delivery. So in most cases, that's maybe 2 or 3 days. It is okay if you do a screening on a baby, say on day 1, and the baby does not pass. You can wait maybe 24 hours if you have 24 hours and do a rescreen on that baby and see what happens. We typically only need to report on that second screen. The guidelines do tell us that we don't want to rescreen a baby over and over and over again, that our best practice just tells us to do 2 screenings on that baby. If the baby doesn't pass that second time, maybe on the 2nd or 3rd day, then we will consider that a refer or fail. And that could be whether it's in both ears or just one ear. In this case, we would really like to see that baby come back and get rescreened typically within a week. And in this case, we're going to determine that this baby did come back, family came back, and your hospital was able to provide the rescreen or the follow-up screen. So now as the hospital coordinator, I want to go in and I want to record that. And let's just say that this baby passed when they came back. So now I'm going to go to this follow-up tab. I'm going to add what day the baby came back for the rescreen. And then since the baby passed, I'm going to add in here that the baby passed in both ears. And in this case, because the baby passed, I probably don't need a note. Once I click Update, then the record will fall off of the follow-up report. And we're just running a little bit slow to get the confirmation. So you really do want to wait for that confirmation while you're working in this system. Sometimes you will find that it's working slower than other times. There we go. So what I want to do, though, is in this case, let's say that this baby did not pass. Say they referred again. I'm probably going to want to write a note about what our plan is going to be or what we did as a hospital to help this family. What our goal is that each hospital, when a baby refers twice, and what we mean by that is the baby referred during admission for the initial screen, and then the baby came back as an outpatient for the follow-up screen and referred again. At this point, your hospital should have a referral system in place for what to do for this family. If you're unsure about what your referral process is, please contact me and we will work at updating your system and making sure that everyone at your hospital is aware of what the next steps might be. Typically, this will mean a referral to an audiologist or to the baby's primary care physician. Oftentimes, we like to go directly to an audiologist just to, in order to, for timeliness, to get a baby evaluated in the event that this baby has a hearing loss. In this case, we want to add a note. Maybe you referred this family to their primary care physician. So you would type in a note. Simple notes are fine, keeping in mind this is not a medical record. This is just a way for us to keep tabs on what happened with the baby. Okay, so this is pretty much all we need to know about this baby. This is going to help us in the event that, let's say this baby ends up with a hearing loss and it's not identified until the baby's 2 years old. Oftentimes our audiologists want to refer back to the newborn period and see what happened during that time. So when you're trying to decide whether or not you want to put a note in these note sections, that's a really great way to make that decision. So if you think ahead and say to yourself, what if this baby is identified with a hearing loss at, say, age 1 or 2, and that's what we would actually call a late identified hearing loss. Think about what happened during this time that might have posed as an obstacle to this baby being identified earlier. And so oftentimes hospitals will like to put something in there that will show the efforts that they made with the family to help the family get the services that they need. So this is a note that you might want to put. If you find out later, maybe 2 months down the road, that this family never followed up with the primary care physician, you would be able to come back into this record and say, discuss with family, no follow-up occurred because they don't have transportation, could possibly be a reason. So that's how you would take care of that. This would be an appropriate place to say, for example, if a baby came back and was unable to get a screening because perhaps your equipment was down, you could say family returned for follow-up, but hospital equipment was not functioning. Scheduled family to return in 1 week. This would be a good example of documenting what happened with the family. And so, again, this is not a medical record, should not serve as a medical record. Any information per your hospital policy should be documented in the electronic medical record or chart at your hospital. So one thing that we're going to do is I'm going to show you, let's see, I'm going to go into one more record. And again, you can either click on clear, which will clear the entire record, or you can go in here and replace an ID number, and that'll actually swap them so that you get the record you're looking for. There's multiple ways to do it. So now I'm going to go into our last one. So what this record is showing me, so this is how, maybe I see this on my report. This is a baby that's still showing up. So in this case, this baby referred in the left ear and actually passed the right ear. And when the baby came back, they referred in the left ear again and passed in the right ear again. So one thing to keep in mind is when you're documenting a follow-up screen in the case of a unilateral refer or a unilateral pass, such as this particular case, when that baby returns for screening, you want to make sure that you actually rescreen both ears. The reason why we want that to happen is we just don't know. Sometimes maybe we documented the initial screen incorrectly, whether that be through the electronic birth certificate process, or maybe we did that ourselves. Or sometimes it just happens to be that maybe a baby truly was having some hearing loss in the ear that passed, and it really didn't show up that day, and we want to make sure that we rescreen that ear again. So some hospitals have a more detailed follow-up process than others. So in this case, what I want to do is give you a little information if you're trying to find out maybe what happened with this baby. Maybe you're questioning whether the baby made it to evaluation or not. We're not going to find that information in this record unless you happen to work at a hospital that's tied in with an audiologist. You may have a little more information than others. But what we can do is, I mentioned to you before that search tab, which was the meat and potatoes of our record. So I want to go back out to get into that tab, and the way I'm going to do that is I'm going to hover over my name here, and I'm going to click on IDS Data System. Again, that's getting back to my home page. And then I'm going to go into the Search tab. And I'm going to look up this baby. And since I know this is a specific last name, I should be able to pull it up. And there he is. So I'm going to click on Load. And again, this is really just if I'm looking for a little additional information on this baby. This is actually an area where I can see, based on the birth certificate and what was entered on the birth certificate, I can see an address for the baby. I would see the mom's name and the father's name. I would get some birth information here in this tab. And again, this is, of course, all mock information. And then these little green, what they look like they're lit up, that just tells me automatically that there's data within those fields. And so I can see my hearing screening here too. What I should be able to do, if there was a diagnosis that was entered into our data system, soon we're training our audiologists to enter directly. Currently they send us a paper report and we enter it here. Then I would be able to go into this diagnosis tab. And if there was a diagnosis, it would have the diagnoses listed below here. And if you were to go into those diagnoses, it would give you information about the audiologist and who made that diagnosis. You would also be able to click on this communication tab, and it would let you know, it would actually show you whether a letter has been sent to that baby or not. One thing that we do not have within this system, unless we were to add it manually, is a family's phone number. And this is another reason why we're very dependent on hospitals to help us and be our extensions for families and babies that need follow-up, because typically hospitals will actually have that information readily available. And again, at the State Health Department, we don't have that. Usually the first time we see a baby's phone number is typically when an audiology evaluation has been done. Okay. So this actually completes the section of entering data. You can see that in most cases it's pretty simple. Should you find that there be some outside circumstances that perhaps you're not sure how to handle, then you can always contact me. I'll have my contact information here at the end. But some things to keep in mind is that, again, you will only have access to the babies born in the hospitals that you are associated with. Sometimes in some cases, your hospital will provide a screening for a baby that was born at home. Our home birth is considered its own site, and no one, actually, other than state employees, have access to that site. So in the event that you screen a baby that has a home birth, then that's a situation where you will have to contact me, and you will be able to give me that information, and I will go into the system and update it. But please do let me know if you do have any results for home screen births. We absolutely want to record those results as well, and then we can do it in that manner where I can enter it directly. So I'm going to go ahead and put up my contact information for you. And many of you already have my email address. You can see it right there, my phone number. I will let you know I'm often away from my desk, and have it's a little more complicated for me to retrieve my voicemail. So if you're having any issues or questions regarding data entry or the data system, and actually any processes or procedures just relating to the follow-up program, go ahead and shoot me an email, and I have a little better access to seeing your email. So what you'll see on this screen as well, it says password. It says Spring 13. You're actually going to need this password when you do a request to become a user for our database. And as I mentioned earlier in the training, just contact me via email. Let me know that you're ready to become a user and begin using the system. And then I will send you an instruction sheet on how to walk through the steps to become a user. You'll need to provide for me this password for us to complete that. So I want to thank you for participating in the Newborn Hearing Screening IDS Database webinar training. This is really meant to be kind of the basics of the training. Once you view this training and you're ready to start entering data yourself, I'm happy to sit on the phone with you initially to get moving, or if you're having any trouble getting logged in or anything like that. So for now, I will be the main contact for this process. All right, thank you.
The organizer